Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Ahmed here with us this week. He flew 19 hours, 13,000 miles to be here for his chiropractic care. He's had chiropractic care over in Amman before, but they twisted him on his side, and that didn't really help. It kind of hurt even, didn't it? Yep, and he's brought his MRIs and his x-rays with him, which is great. So I've already looked at those. We've already done his orthopedic neurological evaluation. And I am ready to adjust him for the very first time here at Advanced Chiropractic Relief. He's going to be with us here twice a day for 4 days in a row this week. So what I'm going to have you do, Ahmed, is close your eyes and bend your head forward and backwards for me. Then back to neutral. Now see, he's got that forward head posture. His ears dropping way out here in front of his clavicle. You feel that? Should be back here over your shoulders. This is increasing the weight-bearing compressive stress all the way down into his lumbar spine. He's a little bit cocked off to the left of center as well. You see how you have more room here than you do over here? So your pelvis has shifted left of center as well. Now, Ahmad has lost the entire lumbar lordosis due to muscle spasm in his low back. He used to get in antalgic postures like this a lot, right?
Yeah, for about 3 months.
Yep, 3 months worth of that. Alright, so I'm going to adjust him on the BioPhysics table here first. Let's go ahead and lay you on your tummy for me, Ahmed. Now see, his legs are even, but when I bring his legs up, that tightens up in your low back right there, doesn't it?
Yeah.
Yep. So he does still have a positive knotless. You don't have to have a short leg to still have a lumbosacral problem. He has a herniated disc at L4, L5, with some thickening of the ligamentum flavum, which is inside of the spinal canal. And when that thickens, that closes down the spinal canal and narrows where the spinal cord goes through. And see, this lower thoracic region is really so far out because of this lumbar spine being straightened out here. So I'm going to start off by adjusting his sacrum right down the center here, superior to inferior. I'm pushing this away from L5, which I showed him the x-rays before we got started, and he showed him how the L5 vertebra had slipped backwards on top of the sacrum, and that's where he's getting the herniation right down there. And that's what shows up on the MRI as well. Now I'm adjusting his left SI joint, right SI joint. And now, this is the biggie here, L5, straight P to A drop. L4 straight P to A. L4 is also herniated. There's L3. There's L2. A little more significant in person, huh?
Yeah.
Alright, you're going to feel your head popping up a little bit. You notice I'm leaving his thoracic spine alone for right now because I'm going to adjust him on my Gonstead knee chest table. There we go. Okay, let's turn you on your back now, please, sir. I'm going to take your head off for just a second on this one.
Yep.
You can put it in that chair right there. Yep. Okay. There we go. Slide down this way just a little bit, please, sir. Yep. And I want you just to relax that for me. There. Now, Med's having pain that shoots down into his right leg, into his big toe. That's the L5 nerve, and we tested all that on the orthopedic neurological test, and he does still have good reflexes in his patella and Achilles. Now, just relax this leg. There we go. You should have felt that in your knee all the way up to your low back.
Yeah.
Same here, just relax this one. Yes, sir. Okay, Amanda, let's come over here on this table now. You're pretty tall, so I'm going to lift this up a little bit. I'm going to have you put your knees right back here towards the back part of this, shoulder width apart, and put your face and chest up in here. And just let your spine kind of drop in there and relax. Okay. So see, I want to have this lower thoracic right here, right where he's got that significant tension. You feel that muscle spasm right there, man? Okay, I want you to just slide up in here just a little bit. There you go. Okay, I'm pisiform on pisiform, right? T12L1, the toughest part of the spine to adjust. There it is. And right up a little higher. There we go. You feel those?
Yeah.
Okay, let's come over here on this table. Okay. This is why he flew 19 hours right here. Let's lay on your back. There we go. Slide up just a tad there. It's going to feel kind of tight on me. Let your legs bend and relax naturally here. You staying at the high here, man?
I'm staying at the park.
Oh, okay. Just relax your hands right there. Okay, now just keep your teeth together. Breathe through your nose only. And just let it go and exhale for me. There you go. Yes, sir. Uh-huh. That's why we call it ring downer. You feel that all the way down?
Oh, yes.
Okay, keep breathing. Yes, sir.
Oh.
Yeah, you took that like a champ though, buddy. Just relax. Keep breathing. Now, I'm not saying keep breathing so they're staying alive. I'm saying keep breathing because that breathing will help reduce pain. Okay, let's come over here in front of the mirror now again. You should feel a little lighter already.
Yep.
Alrighty. I'm going to have you close your eyes again, Ahmed, and bend your head forward and backwards for me. That's already better range of motion. I probably didn't feel as stiff that time. See, take a look. Your head's still a little forward, so your homework is this. You're going to pull both shoulders up and back simultaneously. Now see what he's doing? He's kind of jutting his head forward. You want to avoid that. Avoid that. And just let your neck go. So you bring it straight back. And then you're a little right, so we'll go there and then tilt all the way. Look at the wall behind you, man. You want that much extension in there. There, okay, now relax. Now try that same thing again. Forward, backward, and back to neutral. That should have felt smoother to you. Good. All right, my friend. How's your right leg pain right now compared to when you walked in?
I don't have a lot of leg pain right now.
Your right leg pain's gone?
Yeah, I feel
Still sore down low,
yeah,
huh?
sore down my lower back.
Okay.
Around the SI
Yeah, you
joint.
will be sore after your first adjustment
Yeah.
here. We're going to be doing this twice a day, though, for 4 days in a row. So it's going to be like a heavy-duty workout week for you.
Yeah.
So expect to be sore. Now, after you get an adjustment the first time or two, you're going to be sore like a new workout. So if you get too much inflammation or soreness, put crushed ice in a freezer baggie directly on the skin for 20 minutes. Not a frozen pack you throw in the freezer or frozen peas like my mom always says. No, you got to use crushed ice in a freezer bag. That's state-of-the-art sports medicine, believe it or not. It has to be right on the skin because it has a greater surface area, crushed ice does. It gets the skin colder and reduces the inflammatory process and is a great analgesic because it cuts down the circulation in that area. So, crushed ice in a freezer baggie and drink tons of water, about a gallon a day.
Will do.
All right, this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief with the mod who flew here 19 hours to see us. We'll see y'all soon.